Hi, Catherine. It's Caro Overdulve here, and this is my subject, Christian, which was the subject that I used in the previous two videos. So basically today, we're going to talk, before I talk about the cruciate ligaments, I'm going to just quickly review the MCL and the LCL, which I didn't talk about yesterday. The MCL, the medial collateral ligament, just motioning him to lie down. The MCL basically extends from the medial condyle of the femur down to the medial condyle of the tibia. The LCL, the lateral collateral ligament, begins at the lateral epicondyle of the femur and extends to the head of the fibula. And the LCL is generally considered the stronger of the two ligaments. So now basically I'm going to just move the video down so you can see the tests that I'm going to perform on Christian. Maybe let's just put that, yeah, right like that, thanks. So today we're going to do cruciate ligaments, and the first ligament is called the anterior cruciate ligament, and it attaches on the anterior portion of the intercondylar area of the tibia and runs superiorly and posteriorly to the internal aspect of the lateral femoral condyle. The function of the ACL basically is to reduce any anterior displacement of the femur or the tibia. And the second ligament that we're going to test today is called the posterior cruciate ligament. It attaches on the posterior aspect of the intercondylar area of the tibia and runs superiorly and anteriorly, passing the ACL on the medial side and attaching to the internal aspect of the medial femoral condyle. And its purpose is to reduce or prevent posterior displacement of the femur or the tibia. So just as a review, if this is the knee joint, side to side of the lateral ligaments, try to stabilize the knee and keep it stable without keep it in, I guess, in joint, if you will, for lack of a better word. And today the cruciate ligaments are to prevent any anterior or posterior translation of the femur or the tibia. Okay, so the first thing that we're going to do is we're going to put Christian's hip in a 45-degree flexion and put his knee at 90-degree flexion. And what we're going to do first is there's two types of tests that you can do for the one each for the PCL and the ACL. And for the ACL, we're going to start with the PCL test first, which is known as a posterior drawer test. And the reason we start with the posterior drawer test first is to eliminate any detection of injury in the PCL, because an injury to the PCL can actually produce a false positive in the anterior draw test. So I'm going to do a posterior draw test first. So what I'm going to do is I'm going to put my thumbs inside the medial and lateral joints of the knee, and have my fingers pointing into his hamstrings. And what I'm going to do is I'm going to push the tibia straight backwards from me. Okay. Some videos online that I've researched say that you have to push in an explosive motion, but I'm going to go with what you have listed on our website. I'm not really sure about this, but I would think that doing gently causes less pain to my patient. And you could probably still, I'm assuming this, but I'm thinking if you push it gently, and if it's still going to translate posteriorly whether you go explosively or not. So just to be on the safe side, I'm going to just push the posterior PCL gently, push the tibia gently to see if there's any posterior translation in the PCL, or in the tibia, sorry. So I'm pushing through, and a positive test would give me a posterior translation of more than 6 millimeters, and I would also have a soft and mushy end feel, and I don't have that. So I'm eliminating the possibility that there is a PCL injury. So now I'm going to do the anterior drawer test, which tests the stability of the ACL. So again, I'm going to do the same thing. I'm going to put my thumbs in his knee, in his lateral and medial joints, and I'm going to pull the tibia gently towards me. and I'm palpating for any translation of the tibia in the anterior direction, and I don't have that. A positive again would be an anterior displacement of the tibia of more than 6 millimeters, or a soft mushy end feel, and I don't have either of that. So based on the tests, this guy is good to go. So we have, just a review, we have the two collateral ligaments, side to side stability, and we have the cruciate ligaments, which prevent backwards and forwards displacement or anterior posterior translation. And we have the meniscus, which basically acts as a shock absorber for the knee. Okay, so that's it for today, and I guess we'll see you next time. Thank you. Have a good day. Bye-bye.